So heart disease or coronary artery disease is a disease in which there is deposition of cholesterol or fat inside our coronary arteries. Coronary arteries are those arteries which are running on top of the heart. They are usually 3 in number with their branches, and they supply blood to the heart constantly from the time we are born until we die. अब ये आर्टरीज के अंदर धीरे धीरे ड्यू टू वेरियस रीजंस deposition of fat starts building up from a pretty young age, and ये slowly over a period of time, over years, ये accumulate करता है और उस flow of blood को obstruct करने लगता है. Symptoms तभी आते हैं जब obstruction to flow of blood is usually around 70% or more, and these symptoms can be angina, it can be breathlessness, it can be heart attack, or it can even be sudden death. So our job is to detect this disease before it produces any of these problems. Then we can be successful in preventing the complications of this deadly disease, which include major heart attack, damage to the heart, and even death. So the best way to diagnose these condition is to go to your doctor, who is either a cardiologist or a physician, and who will do a testing both of what are the risk factors that are there in you. Certain blood tests such as for sugar, for cholesterol levels will be carried out, your blood pressure will be checked, and over and above this, certain tests for to look at whether any blockages have already occurred inside the heart can be done. These take the form of tests such as a treadmill test or a stress test. इसमें हम क्या करते हैं, we make the person walk on a treadmill in a graded fashion and increase his blood demand of the heart by making the heart work, pump harder and faster. And if there is a lack of blood supply due to blockages in the heart, it shows up in the ECG. This is a good way of testing whether or not there are some blockages in the heart, and this is what is routinely done in many preventive health checkups that you go to hospitals. Some people may require direct visualization of the heart arteries, such as we can do by CT angiography or even by coronary angiography, which is an invasive test. Usually the invasive test or coronary angiography is done in people in whom we have a strong suspicion that they already have critical disease in them. Who are these patients? These are patients who already have symptoms which are suspicious. These are patients who have got an abnormal non-invasive test. These are patients who have got already suffered from a heart attack, or these are patients who have got a strong family history of heart disease, जिनमें some symptoms are starting to appear. So this can be the way that the doctor may order a series of tests to look for heart disease in you, whether you have symptoms or not. In India, we have one of the highest pools of patients who have got heart disease in the world, and there are many reasons for this. In India also, it is known that heart attacks occur in persons 10 years before they occur anywhere else in the world, which means that we have a large number of younger people who are harboring at least some stage of the disease. So it's very important that we act to diagnose this problem early. The best time to go to a doctor is when you don't have the disease, so that he may advise you what you can do to prevent this disease from occurring. This may take the form of preventive health checkup, which many hospitals run, in which your risk factor profile is looked at. Your certain non-invasive tests like ECG, echo and a treadmill test may be done. In case you have decided to go for a preventive health checkup, make sure that dietary consultation is also included because much of this problem occurs through what diet we take. This is if you have no symptoms. अगर आपको कोई symptom हो which is based or which occurs during exertion, especially if it is discomfort or pressure in the center of the chest which occurs on exertion and then gets relieved after you rest, undue fatigue or undue breathlessness, for example अगर आप पहले 2 राउंड ग्राउंड के लगा सकते थे comfortably, now you find after the first round you have to stop and you're getting out of breath, or you could climb 3 flights of stairs and now on the first flight of stairs आपको लगता है that you're getting out of breath or you're having some discomfort. This is a very suspicious sign. Go to the doctor and get yourself checked for heart disease. कई लोगों को symptoms of gas or upper abdominal discomfort होता है. This can occur due to heart disease also, especially if the artery which runs on the bottom of the heart gets blocked. These patients have symptoms of discomfort with exertion or a sense of pressure in the upper part of the abdomen and they feel it may be due to gas. So go to a doctor अगर आपको ये relief नहीं हो रहा है with usual gas relieving medicines. Third time you should go to a doctor is if you have got a strong family history of heart disease in your parents or in your first close relatives. You may be having severe heart disease even without your knowing it at a young age. तो अगर ऐसा है, please make sure your blood levels for cholesterol are checked and you are tested for whether you are carrying any heart disease. Of course, अगर आपको कोई problem already हो चुका है, for example आपको already heart attack है या already आपको कोई procedure हुआ है जैसे angioplasty, after that regular checkup with your doctor is mandatory for secondary prevention. So I will summarize that before you have heart disease or before you have any symptoms, go for preventive health checkup. अगर आपके पास कोई symptom है जैसे मैंने बताया, go immediately for checkup. If you have suffered from any problem, make sure you go for regular follow-up with your doctor because second time the episode might be much more severe.